And I would get in the middle and say, you know, stop arguing, stop arguing. And I've always been interested in people. At one time, I worked in advertising, and I had my own television production company. And I would be on the set, and my job was to go out and get the job, and then to actually produce the job and work with my partner who directed the work. And I would be on the set, and my job was to basically handle all the people on the set. So there had to be anywhere from 25 to 50 people on set, and then probably anywhere from 10 to 20 people, advertising people. And I would just handle them. It wasn't even a problem for me, because I was always good at listening to people. And I was always good at being able to articulate what someone needed at the particular time and do it in a very simple way. So when I got out of advertising, I decided, maybe I should go to school and become a therapist. First, I got involved in spiritual counseling. I became a spiritual counselor. I became a minister, interfaith minister. And then after that, I got into learning how to become a psychoanalytic psychotherapist by studying psychoanalysis. I'm not certified. I don't have a license to do that. But with my training, I did work with a lot of people. And what I decided to do, because it was psychoanalysis, you didn't really ask the kind of questions I wanted to, which led me directly into coaching.
It was more of the Freudian method?
Yes, it was more Freudian. And that brought me into coaching and brought me into the whole world of mental health. And as a matter of fact, I work right now with someone, his name is Dr. Daniel Amen, and he's in New York City, all over the world actually, and he's asked me to come in and be a coach with his staff. So I love to work with people. I love to talk to people. I love to help people if possible, because there's so much that I can learn and also contribute, because I'm here to serve. And if there's a way that I can do that, whether it's talking to somebody, whether it's staying in my kitchen and cooking, because I grew up in an Italian restaurant and I know how to cook, and or whether it has to do with music, because I'm a music person. I have a music background as well. So that kind of led me along the route.
Do you find that music has helped with dealing with mental health issues?
Absolutely. Music is one of the key elements they're finding out in studies. There's a lot of study around neuroscience, and they're finding out, amongst other things, that music is one of the key things that can help people, because it works on not an intellectual basis, it's working on an emotional basis. So therefore, it is literally going inside your body. So it can literally change the DNA. So if you're feeling in a very bad mood, for whatever the reasons, go play music, because instantaneously it'll take you someplace else. And the other area that neuroscience has done a lot of work on is in gratitude. Because the thing about gratitude is that if you're in let's say, a bad place, let's say depression, for lack of a better term, if you can shift that to be grateful about something, the brain can't handle more than two thoughts at the same time. So it'll take you out of the depression. And it's a practice. But they're studying it through neuroscience. But music is clearly something that's really powerful for people, very powerful.
Excellent, excellent. Here we have a list with us to talk about mental illness in a kind of in a general way, but we go over here the types of mental illnesses, and we're going to talk about that a little bit for you. So here we have mental disorder notes. I'll just read this. A mental disorder, also called a mental illness or psychiatric disorder, is a behavioral or mental pattern that causes significant distress or impairment of personal functioning. Mental disorders are usually defined by a combination of how a person behaves, feels, perceives, or thinks.
Absolutely.
So maybe we can go into some of the different types of mental illnesses that there are.
So I'll be reading off of this just so
Sure.
everybody knows this, because, as I said once before, there's a lot smarter people than I am. So I like to just work from that. This came out of off the internet, as everything comes off the internet. And
Where did we find this one?
I believe this was from WebMD.
Oh, good.
Okay.
WebMD. That's very good.
Yeah. So you've got, for mental illness, you've got mood disorders such as depression and bipolar disorder, and I'll go through them later.
Sure. Which is something that I was once diagnosed with.
Bipolar?
Bipolar disorder.
Uh-huh.
And then because I had psychosis, the diagnosis was later sort of changed to schizoaffective disorder.
Okay.
Which is basically bipolar disorder with aspects of schizophrenia. I didn't hear voices and I wasn't seeing things, but most certainly I was believing things that were not true. Yeah.
Good point. Good point. Anxiety disorders, which at some point we all get anxious. It's a question of how much and when it becomes a disorder. Personality disorders.
Such as?
Borderline personalities. Borderline personality is a great example of a borderline personality. Is I had someone who was a borderline. I had them for a year. They thought I was the greatest thing ever.
At first.
At first. And then they came in and they told me something, and I said, gee, maybe you ought to get a second opinion on that. And they went absolutely
berserk
and got up, walked out, and I never saw them again. That's a perfect example of borderline disorder.
Excellent. Would it be considered a personality disorder as well as narcissistic personality disorder?
Sure. Sure. Absolutely. It goes hand in hand.
Those two, narcissism and borderline, are often
they're
comorbid,
comorbid, as we love to say. Don't you love that word? Comorbid.
Funny word.
Co-death. I love that. Psychotic disorders such as schizophrenia, eating disorders, trauma-related disorders such as post-traumatic stress syndrome disorder, and substance abuse disorders. Those are types, but we could literally go into what each one means.
Right.
Is that okay?
Sure.
So we've got clinical depression, which is characterized by persistently depressed mood or loss of interest in activities, causing significant impairment in a daily life. Someone had asked me a little bit about that before, and I said, well, some example would be, you know, you just don't feel like getting out of bed, for example. Or you know that you have to do work, but you just don't feel like doing the work. Or
lack of
motivation, lack of any kind of feeling like I should take care of myself. Because people
self-care goes out the window.
Self-care goes out the window, and what, as human beings, we need to learn how to love ourselves, how to take care of ourselves, which is critical for personal growth and for mental health. Anxiety disorders characterized by feelings of worry, anxiety, fear that are strong enough to interfere with one's daily activities.
Right, such as working.
Go ahead. Tell me a little bit of that.
Oh, about anxiety?
Yeah.
Oh, what can I tell you? You know, for some people it's debilitating. For me, my anxiety has sort of leveled out.
Oh, that's
great.
great.
I take one medication. I take something called risperidone, which, if you've tuned into the show, I've probably talked about it, which is used to treat schizoaffective disorder. Now, I take a very small dose. It's only 1 milligram in the morning, 1 milligram in the evening. That's great compared to what I used to be on, which was 4 different medications. One of them being Depakote, another mood stabilizer, an antipsychotic, and
as we would like to call it in the profession, a cocktail.
A cocktail.
Let's have a cocktail.
Let's have a cocktail. 4 medications, please.
Now we have bipolar disorder.
Yes.
Associated with episodes of mood swings ranging from depressive lows to manic highs.
And sometimes manic highs to depressive lows.
Yes. Or the other way around.
Or the other way around. or a mixed state. I don't
Yeah.
know if we're going to talk about a mixed state.
Yeah.
A mixed state is
No,
something
we don't
where
really
you,
talk about
where
it, but it's
rapid
combination.
cycling. Yeah, if you look it up, it's very, very good. A mixed state is when you're having very, very high highs and very low lows,
Yeah.
but at in a very short period of time. And sometimes they call it rapid cycling, which sometimes when people are hospitalized, they'll go to the doctor at the hospital, at the ER, as it were, and basically they're tracking, or they're going to check, when was your high mood and when was the low mood, and sometimes if it's within the same day, that would be considered to be possibly a mixed state, or rapid cycling, I think it's called.
Yeah. Sometimes called manic depression. Bipolar disorder causes extreme shifts in mood. People that have it may spend weeks feeling like they're on top of the world before plunging into deep depression. The length of each high and low varies greatly from person to person.
Yeah, it's true.
All right?
Yeah, because it could be that, when I had more of a depressive episodes, I should say, with bipolar disorder. It wasn't really, I wasn't spending large amounts of money. I wasn't gambling.
Right.
Wasn't doing any of those things. But for me, it was really difficult to get out of bed.
Yep.
I couldn't get out of bed, and I couldn't find any motivation, and I felt so weak and so useless. I had no purpose, and I just couldn't see any reason to exist or to be alive.
Yeah, that must have been very frightening.
Yeah, it was terrible. It was one of the worst experiences of my life.
Well, I'm glad you're out of it.
There were two big ones: my father's death and the divorce. And the divorce was a really tough one because it really stopped me from playing music, which is, with my father's death,
We're
1
back
year
to music.
later,
Yeah.
I dove right into music.
Right.
Became my
So
world.
next one is dementia.
Yeah.
Thinking.
Which is not only for old people.
Yes, exactly. A group of thinking social symptoms that interferes with daily functioning. Then we have attention deficit disorder, which
Right.
is my area. Chronic condition including attention difficulties, hyperactivity, and impulsivities.
Schizophrenia.
Schizophrenia, disorder that affects a person's ability to think, feel, behave, and clearly, and they go back and forth between any number of different things.
Usually for schizophrenia, they don't have it here, but that's also categorized by hallucinations.
Really?
Auditory and visual. So if people are starting to see things that aren't there, or they're hearing voices telling them to do things or whatever, and basically that is schizophrenia.
Right.
And that can be treated with
Medication.
many different kinds of medication.
Then we've got obsessive compulsive disorder,
Right,
excessive
OCD.
thoughts, rumination that lead to repetitive behaviors, compulsions, obsessions.
Such as stacking things or collecting things or putting things in a certain order so that you would get the, let's say, a desired result in your life. Do you think it's going to change something? So maybe you have to wash your hands 20 times before something like that. That would be OCD.
A real mild case would be Jerry Seinfeld, where everything had to pretty much be in place all the time. I think he did that as a joke or as something that.
Was it a part of the show, or
it was his personality, but it was part of the show. It had to be pretty much exacting in a particular way. The other thing is autism, serious developmental disorder that impairs the ability to communicate and interact. I don't know if anybody been around autistic children or autistic people, but they're a particular kind of individual, and it's not easy to basically be around them, touching them, or communicate, touch them, any of these kinds of things.
Right.
Post-traumatic stress syndrome or disorder in which a person has difficulty recovering after experiencing or witnessing a terrifying event.
Such as 9/11.
Such as 9/11. I've been diagnosed with that myself. As a child, I was, my dad had a restaurant, and I was told I had to go down into the basement to, amongst other things, make boxes and grade Italian cheese and all these kinds of things. And I was very young, maybe 4 or 5 years old, and I would go down and I would say, this is like the dungeon, because the steps have been worn down and there was water from the dishwasher, the dishwashing man who was washing these dishes. And I would go down there, and there were basically water rats down there. And I didn't even give it too much thought. I said, oh, you know, it's water rat. It was only after years of, I was in therapy, and the therapist said, you know, at 5 years old, you're not supposed to be down in the basement dealing with water rats. And they classified me as post-traumatic stress syndrome. And I went to a therapist who was a behavioral therapist. And in my case, I was asked to write about it, and then we would come in and discuss it. And it's always in the background, but it's not debilitating the way it was. And post-traumatic syndrome is one of those things where you don't necessarily realize that you have it, but your behavior is one that you're doing things to basically undermine yourself.
Self-sabotage.
Self-sabotage. Because
to avoid certain situations.
Avoid certain situations. You don't think you're good enough.
Self-worth.
Really looking like there's something wrong with you, and you don't even know why.
So even if you had some sort of ailment or something like this, or maybe it would be that you believe that something was wrong with you. So it would be some sort of dysmorphia, even.
Yeah, absolutely. So that about covers it here. We've got different drugs, but I'm not a doctor, so
I'll read this part.
Okay.
Read this part. So it says there are different types of medications for mental disorders. By no means is this medical advice or anything like that, but
no.
Just reading this from WebMD so you can hear it. There are several different types of drugs available to treat mental illnesses. Some of the most commonly used are antidepressants, anti-anxiety, antipsychotic, which I used to take, mood stabilizing, and stimulant medications.
That's what they use for attention deficit disorder, stimulants.
Stimulants.
Yeah. What I found more than anything, if I could just talk about attention deficit, when I work with people, whether it's individual with ADD or I'm dealing with entrepreneurs who most likely have the signs, symptoms, and behaviors of somebody with ADD, my job is to really bring clarity and focus to them to help them move along. And the way I do that is I really spend time determining where their strengths lie. What are they good at? And when we can discover what they're good at, then we can apply that to their businesses. And invariably, it's not unusual that people can like double their income in like 6 months. Why? Because they're doing what they love to do.
Yeah.
It's as simple as that.
Which is just about everything.
So I'm a firm believer in strength-based therapies of some sort.
That's great. That's great. Yes. All right, that moves us to the last part of this section, where it talks about 5 ways to move out of depression, mental illness.
Well, the first one is really awareness. The most important piece of this is to become aware and to accept that you're having difficulties in some way, shape, or form, whether it's depression, which usually shows up like that. The best thing that you can do when you're having any kind of situation like that is to put yourself in a therapeutic situation, possibly see a doctor, try to see if you can get some medication around this. The second thing that is part of this is shifting beliefs. Now, what do I mean by that? Before the age of 7, we are in an environment where we are dependent on our families. We're dependent for love, we're dependent for sustenance, and we're dependent to help us become self-reliant. If those three things are not in place or attempted to bring in, what will happen is that you'll wind up, for example, needing love because you didn't get it as a child.
And so these disorders
So
can...
a lot of disorders will come out of that. And so, again, beliefs may be, I'm not really good enough, or there's not enough money out there, or I can't really make money. Money doesn't grow on trees. Or why do you want to be with that person? Why do you want to be, conductor in an orchestra? What are you, crazy? You can't make any money.
Things that diminish the person's
Right.
self-worth.
Right. And those beliefs can be shifted if you pay very close attention to it and do certain things around that, because when that happens, it really makes a profound difference in your quality of your life.
Great.
The third one is gratitude, and I spoke a little bit about that. Gratitude, I recommend every day you sit down and you write a list of 10 things that you're grateful for. Now, these things don't have to be like you wrote the world's greatest novel. It can be as simple as I got out of bed today and my feet hit the ground. I'm grateful for that. Accomplishments. Or I brushed my teeth today. It could be any of these things, because the more that you bring this into your thinking, the more thoughts are things, and the more that you do that, the more your life will begin to, you'll start to experience positive things in your life as opposed to negative things in your life.
Great.
The other thing is I'm a big proponent of love, because we are here.
Well, it's a fact also. It's a solid fact.
Yes. Yes. And I believe that people need love, as well as, more than anything, they need to be loved themselves. Whenever I'm working with somebody and I'm coaching with somebody, I always tell them, listen, you may think that this is, I'm here to coach you on attention deficit or coach you on your business or something like that. I tell them that this is really a course in love. And what we're doing here is to have you fall in love with yourself. Very powerful.
Very good. Very good. Universal message.
And the other one is music. I mentioned that.
Mm-hmm.
So music can help in any number of ways, whether you do it from a lyrical standpoint. And when I say music, I'm really incorporating all the arts. It could be dance, it could be music,
sculpture,
it could
painting.
Sculpture, it could be architecture,
any
it could
kind
be
of
anything.
outlet.
Exactly.
Sure, which brings us to a song.
Oh, okay. Yes, I'd like to sing a song. I was going to do it live on the piano, but the piano that we have here is a really great piano, but in terms of me playing it, my fingers are a little bit too big for it.
Okay, so maybe you can...
So what we'll do is we'll do it a cappella.
Yeah, great.
And this is called Turn It Over. I call this when your life hits the wall and you really can't go any further, you need to turn it over. You need to give it up. So let me give it a go here.
Sure.
Woke up this morning with an ache in my head. My body so weary, barely dragged myself out of bed. Man, I'm so tired of reshuffling this deck. Feel like I'm the captain on the world's largest shipwreck. And I'm wondering once again, why can't I connect? Then I hear, turn it over. Have faith in what you can't see. Turn it over. Put a little trust in me. Turn it over. Let go of trying to hold on. Turn it over. Turn it over. Now I don't want a mansion, but a nice place would do. How do I get there when there's so much to work through? My friend's good intentions about to drive me to the edge. Would love to take a drink, but you know I took the pledge. Hey, is anybody out there watching me as I'm walking this ledge? And then I hear, turn it over. Have faith in what you can't see. Turn it over. Put a little trust in me. Turn it over. Let go, try and hold on. Turn it over. Turn it over. Ooh, feels like I'm running out of time. Ooh, I want to claim what's mine. This must be life's great mystery. I'm not your Sherlock, I'm just trying to be me. Ooh, this time I'll get it all straight. Ooh, then I can stop this wait. Well, if I keep living in fear, I won't hear the voice you want me to hear. Turn it over. Have faith in what you can't see. Turn it over. Put a little trust in me. Turn it over. Let go, trying to hold on. Turn it over. Turn it over. Turn it over. Turn it over.
Great. Thank you, Frank.
Thank you.
Thank you so much for coming on the show. It's really been wonderful.
Thank you, man. Oh, we wrapping up?
We're wrapping up. We're out of time.
Gracious.
We're out of time.
Oh,
You did it. You did it great.
Thank you.
So, thank you for joining us. This has been another episode of Conversations About Mental Health. I'm Todd Goldfinger. This has been Frank Coppola. Thank you for joining us.
Would
Wish
love
you all
to
the
hear
best.
from anybody who
Yes.
needs some help.